Ji, Bismillah ar-Rahman Rahim. My name is Shakeel Puri. I'm the president of Association of Pakistani Physicians and Surgeons of United Kingdom. We welcome all of you who are watching us from all over the globe. And we also like to share that we have a very well-known, a very seasoned um, medical professional from Pakistan who's joined us, and she will be blessing us with her views with regards to COVID-19. For the people who are watching us across the world outside Pakistan, let me introduce you Dr. Yasmin Rashid Saiba. She is the responsible minister for primary, secondary, and health education in the largest province of Pakistan, which is Punjab. By profession, she is a medical professional. She teaches at many levels and has studied around the world, especially in the United Kingdom. Dr. Yasmin Rashid Saiba has very kindly blessed us with this time, and she will be telling us the present situation and also what the plans are in the COVID-19 situation in Pakistan, and especially and particularly in Punjab. The reason we have these sessions, webinars under the banner of APPS UK in the United Kingdom is that we collaborate, we communicate, and we support and promote improvement of medical education all around the world, and in particular in Pakistan. May I just take this opportunity to ask my panelists to introduce themselves briefly before we go to the official starting of the program. Can I please take 1 minute from all with regards to this tragedy happened in Karachi yesterday in the plane crash. Since we are quite sure that this is the last day of Ramadan in UK, we would like to do a quick dua for the people who are actually passengers, the crew members, and also the resident of the area where the plane actually crashed. So our dua is that may Allah bless you all and give you the highest level in Jannah. You died on a Jumatul Wida in also in the most blessed month of Ramadan. May Allah give you sabr. May Allah give you sabr to the families and also the people who have suffered from this. May I also take this opportunity to congratulate Pakistani people who, when the world sees them, they go out of their way. When there is a disaster, people start running away from the disaster. People were seen by the West, by the non-Muslims, that these people actually started running towards the crisis and they start helping with the plane, and they were managed to save a couple of lives as well. So there is an amazing ability of humanity in our nation in Pakistan, which we are proud of. From here onwards now, I would like to take this opportunity to ask people to introduce themselves. Our very respected chair of APPS UK, Dr. Shahina Anjum is here. Dr. Shahina Anjum, would you like to introduce yourself, please?
Thank you, Dr. Shakeel Puri, Mr. Shakeel Puri. I am Dr. Shahina Anjum. I'm a graduate of Fatma Jinnah Medical College, and I'm very pleased to see Dr. Yasmin Rashid here today. I knew her as Yasmin Ashraf. So it's really a proud moment for me. I'm a consultant pediatrician with special interest in neurodisability, which is an area where I would like to work in Pakistan in collaboration with the local specialists. I know that there is a very well-established pediatric system in Pakistan, but the area of neurodevelopmental problems, which includes children who have speech and language problems, motor skills difficulties, behavior, learning, memory, these children are kind of overlooked in a lot of areas, and they are usually called kun zahan bacche, misbehaving, whereas they actually have a genuine medical problem which, if intervened, identified and intervened at the right time, these children can actually do much better than the way they are treated. I know there are some centers in Punjab, some in KP, Karachi. I'm not too sure about Balochistan and Azad Kashmir, where people are working, but this is an area which really needs attention because this is our future generation. With Apps UK, we have been working on several different fronts in Pakistan, and I'll leave it to the specific specialist to introduce their work. But we are trying, and we are very pleased that Pakistani government is very supportive of our efforts and are facilitating us in these areas. Um, Thank you very much. Welcome, Dr. Yasmin Rashid, for joining us today. Thank you.
Thank you, Chair. May I request Dr. Sohail Chuktai, who is our Director of Telecommunications, Telemedicine in Pakistan, to say a few words and introduce yourself, please.
Welcome, Madam Minister, Professor Dr. Yasmin Rashid. It's good to be associated with your work in Pakistan in telemedicine. You've always been leading many innovative projects. और आपके लिए नई बात नहीं है कि आज आप एक और नया major project शुरू करें. And telemedicine is one of things. My role in APPS UK is as the Director of Telehealth and Telemedicine. At the same time, I'm an orthopedic surgeon based in London, and I'm a consultant in telehealth with doing my master's degree in telemedicine at present. My role is bridging the distance between doctor and patient to equalize the physician density between rural areas, between BHU, for example, and THQ. And that is where my focus is. And inshallah, I will be in a position to help you and assist you further in my role. Thank you.
Thank you, Dr. Sohail. May I just ask Dr. Amber Tahir, please, to introduce yourself. Dr. Amber Tahir, Dr. Saba, is our ex-chair of Apps UK. Please, Dr. Tahir.
Thank you very much, Mr. Shakeel Puri. Assalamu alaikum, and thank you, Dr. Yasmin Rashid, for giving us time and joining us. So I'm working as a consultant obstetrician and gynecologist in NHS and a clinical lead in my department. I'm also an ex-chair of APPS UK, as Mr. Shakeel Puri has just introduced. I work for Royal College of Obstetrician and Gynecologists as a trainer and facilitator, and I've conducted many RCOG training workshops in UK as well as in Pakistan, and also a senior academic tutor of University of Birmingham. I work very closely with General Medical Council as an expert witness.
Thank you, Dr. Amber Tahir. Can I please request Dr. Azhar Iqbal Saab, Mr. Azhar Iqbal, to introduce himself, please.
Assalamu alaikum, everybody, and assalamu alaikum, Dr. Yasmin Rashid. It's my honor to be part of the panel member today. I have been associated with the APPS since 2005, which was the year when the Pakistan had a very bad earthquake. And since then, we have actually evolved as a community very nicely. By profession, I'm a plastic consultant. I have been working in the NHS for the last 28 years. And for the last 16 years, I have been a consultant. Besides my clinical responsibilities, I'm also an educational lead for various things. I have been TPD, which is a training program director for my specialty in the Mersey DND for 6 years. And now I've seated what's called JCST, Joint Committee for Surgical Training, which is the advisory body to all 4 Royal Colleges, College of England, Ireland, Glasgow, and Edinburgh. I also enjoy being in the appraisal panel for my consultant colleagues, and I'm the responsible officer for my hospital as well. I have been going to Pakistan for the last many years in various capacities to do voluntary work in teaching and training and operating.
Azhar, you're on mute now. Sorry.
Yeah, we started microsurgical courses in various hospitals, including Jinnah Hospital in Lahore, Nishtar Hospital in Multan, and we've also been going to Civil Hospital in Karachi. And recently, for the last year or so, I've been going to Fatima Jinnah, so that's another connection to ma'am. I would like to actually involve in the teaching, training, and innovation. And the other thing which I would like to encourage maybe my very old friend and colleague, Sohail Chuktai, to actually incorporate artificial intelligence into the telemedicine. Because if you've got the algorithms for self-diagnostic pathways, then you can avoid a lot of these human resources. And this will be a lot more reliable. A lot of work is being done on that. And I hope I can actually participate in a lot of these things. Thank you.
Ji Shakeel Puri bhai.
I think he's frozen.
I think we will invite Dr. Abdul Hafiz, the CEO, the chairman of the organization, to introduce his work at this point.
Assalamu alaikum. My name is Dr. Abdul Hafiz. I graduated from Aga Khan University in Karachi. Currently, I'm working in Manchester as a family physician. I think that's.
Can we invite Dr. Ansar Hayat to introduce his work to the chief guest, please?
Assalamu alaikum. All these people are very
I'm a graduate of Rawalpindi Medical College, and I'm also an ex-student of Professor Yasmin Rashid, and I'm proud of that. I'm a family physician in Wakefield, West Yorkshire, and I'm a clinical director of general practice here. And I'm also a clinical tutor for undergraduate medical students at the University of Leeds. Besides my clinical responsibilities, I'm also an executive member for the Yorkshire Regional Council for British Medical Association and a board member of our primary care network. So my special interest or area is the primary care in the UK and of course in Pakistan, which I think is the most cost-effective way of improvement of the health of the population as a whole.
Thank you, Dr. Ansar Hayat. Can we invite Dr. Samira Sheikh to introduce to the chief guest, please?
Hi, Assalamu alaikum again to everyone. I'm Samira, Dr. Samira Sheikh. I'm a Master of Medical Education, and I'm head of APS UK Wales chapter. And I'm a graduate of Fatma Jinnah Medical College, and I consider myself very lucky to have been a student of Dr. Yasmin Rashid. So I've known Dr. Yasmin Rashid as such an amazing personality, such a wonderful personality that I remember when she came to Gangaram Hospital, we were like, we were infatuated. She brought in so much energy. We had never experienced a professor, a consultant who was so dynamic and so energetic, and she was like a trendsetter. I mean, she gave a different atmosphere to the hospital suddenly. And I'm also witness to her very motherly instincts for her patients, especially the poor patients. And I saw her fighting for them when whenever it was needed. So I'm so proud to be here with you on this platform, ma'am. Thank you.
Thank you so much. Thank you.
I'm aware of Madam's fight for thalassemia when I was in Lahore in Adil Hospital, and Madam was very, very vocal for thalassemia. Can I invite Dr. Hasham Khan to introduce work to Madam?
Thank you. Thank you so much. Dr. Yasmin, welcome. My name is Hasham. I have the distinction of being a non-practicing clinician. I think I'm probably the only one on this panel. I have accrued a lot of experience working in the NHS as a manager or as a commissioner. Currently, I'm actually advising the government of Saudi Arabia on health transformation and working as we speak on developing a post-COVID-19 world for Saudi Arabia. I have also been involved in something very similar in the UK, where I was involved in the sort of staffing models for Nightingale Hospital, which was our COVID ward in London. And I'm very, very happy to be a part of this, and I'll be speaking shortly about what the government of Pakistan can do and how APPS UK can actually support the government going forward. And I'm also an executive member of the Southeast chapter of APPS UK.
Can I give it back to Mr. Shakeel Puri as there was some interruption?
Thank you very much, all of you. I have Dr. Irfan Rashid been introduced. Yes.
Yeah, thank you very much. Welcome, ma'am. I'm the Social Secretary of APPS UK, and I'm also, my comfort zone is I'm a family physician as well as I'm a pediatrician. And I remember, ma'am, when we used to do the thalassemia campaign in Gangaram, because I was being a pediatrician, I was very connected at that time. And other things which I'm doing for the apps is we arranging a teaching and training seminars and webinars, which Hafiz Bhai will put a light shortly, which we have been doing for the last 2 months, how we can give our knowledge to the junior doctors in Pakistan.
Thank you, Dr. Irfan Rashid. Dr. Ansar Hayat, would you please?
Introduction.
Yes, thank you very much. Well, it brings me, this is what it is, the live, things. We sometimes internets and so forth go up and down. Thank you very much all for your time on this Saturday afternoon, Ramadan. Can I please ask our CEO of organization, Dr. Abdul Hafiz. Madam, Dr. Abdul Hafiz is the main man behind this thought, which this process started about 16 years ago. And one sentence I would like to say about him, that he was given the Excellence Award for Primary Healthcare in the United Kingdom last year. He would like to give you a snapshot of what we've been doing in the last few weeks with regards to the COVID-19. Over to you, Dr. Abdul Hafiz.
I think before you go on to Dr. Abdul Hafiz, number one, I'm very grateful that you people have given, that all of you have collected together today and to improve our knowledge in Pakistan. And I'm very happy to see that quite a few of you are my students, and good that I have inspired a few, and you have, mashallah, done so well in life. Pakistan is always, looking forward to its expatriates to help them out in the various specialities. And frankly speaking, if we have progressed in various parts of medical sciences, it's basically because of our people excelling in their particular specialty and then coming back to Pakistan and then starting their work there, which has actually helped us out. And alhamdulillah, at the moment, at least where medical services and medical teaching is concerned, it's because of all of you giving an excellent input and participating in all these activities in which you come and conduct workshops and you come and conduct various seminars and conferences. It will always add up to the scientific knowledge. And inshallah, we are hopeful that we are going to bring in some good reforms. And I'm particularly keen to hear about the primary healthcare system, because at least in Punjab, now our focus is more, although of course we cannot by any chance ignore where the specialized healthcare is concerned, and we have to work very hard to improve the medical education standards. But our primary focus is now on primary healthcare, with a special focus on the Sustainable Development Goals, that we are a signatory to, because we already did not manage to make the mark in 2015, where the Millennium Development Goals were concerned. So our major concern is on Sustainable Development Goals. And I'm sure you're all very familiar with it. So I'll be very happy to hear what Dr. Abdul Hafiz has to say where preventive work, and particularly primary and secondary healthcare is concerned. Thank you very much. Please go ahead.
Thank you, Dr. Sir. Over to you, Dr. Abdul Hafiz, sir.
Thank you very much, Shakeel Bhai. I'm just going to share my screen. Can you see my screen, please, now?
Yes, we can.
Okay, thank you. So essentially, this is the Association of Pakistani Physicians and Surgeons of the UK. But before I go in any more detail, I would just like to ask all the people, obviously, who are watching us around the globe. I'm aware I'm live on Facebook. Please do share this live stream so we can actually reach even more people, and people can benefit from the lot of expertise which we are actually sharing here today. So just two quick questions. I'm sure, obviously, this is just to jog your memories. Who invented the light bulb? And my second question is, who invented the eye gel? Eye gel, as you know, is one of the anesthesia tube which is used in every single operation theater in the world, not just UK or Pakistan. Okay, just going back to the background of the organization, as Shakeel Puri Bhai has previously said, we are a 16-year-old organization. We are the largest body of health professionals in the UK. There are 12,000 Pakistani doctors who are working in the UK at the moment, and obviously we represent them. And we work in partnership with all big organizations in the UK, all Royal Colleges, General Medical Council, as well as many other bodies. The most important point I would like to make here is we are billionaires in terms of our intellectual ability. this is what APPS UK has to offer to the government of Pakistan. Just very briefly, I would like to mention only few names on this screen. We have Professor Sohail Chutai, who is in today's panel. He has been working on telemedicine for the last 10 years. And obviously we have been thinking, campaigning, and obviously he's the one who actually designed this software, which government of Punjab and Governor Punjab team is actually using at this very moment. So obviously this is something not easy. You know, he could visualize what is coming in future 10 years ago. And obviously now is the time when we are sort of in this lockdown, we are realizing that this is actually so important. And we have actually covered this distance within 5 weeks, what we wouldn't have covered over the next 5 years. Dr. Muhammad Iqbal is another very dynamic person within our organization. He actually leads APPS UK Foundation, and he's been doing a brilliant work on that front. Mr. Shakeel Puri, he was actually nominated among top 100 most influential Muslims in the UK. And obviously he's the president of APPS UK, and he's well connected in terms of his, his approach. He actually reaches out to people, and people really love him. Now, going back to my question, who invented iGel? The person behind iGel is Dr. Aslam Nasir, who is actually one of the anesthetists who is in UK. These are the kind of people. Every single anesthesia theater in the world uses his iTube gel. So we have a lot of these kind of highly intellectual people. I'm sorry, there's a time doesn't permit me to go through the whole list. Okay. So obviously these are the kind of people who Pakistan needs to connect with. We have professors from Oxford universities. We have professors who have actually introduced new procedures. We have professors who have introduced new instruments. And as an organization, APPS UK have actually connected them all. And all government has to do is connect with the organization. And then obviously all this resource is at your disposal. Just going back to who invented the light bulb. And that person was Thomas Edison. And obviously you all know. What I would really like to talk about Thomas Edison is his thinking. He did 1,000 experiments to make one bulb which will successfully work. Okay. When he failed 1,000 times, people asked him, how did you feel when you failed 1,000 times? And his thinking was, I didn't fail 1,000 times. I actually know 1,000 ways this bulb will not work. And this is the mentality of APPS UK team. We will not give up. For past so many years, we have been working. We haven't given up. And here we are today. We are sitting with the health minister who have very kindly actually on our request come here and want to work. And inshallah, we will continue working on this journey together. Very briefly, I have got only 6 slides. I've already passed 2, just 4 slides. Very quickly, I would like to give a brief of in terms of what APPS UK has been doing. Our first objective is supporting the doctors and allied health professionals, both in the UK as well as in Pakistan. We run public health awareness campaigns. There's a whole detail on that. And one-third most important subject, which is close to our heart, is improving the health systems in Pakistan. We came from Pakistan. We didn't knew so many things before we came here. And we learned all these skills. And these are all transferable. And we can easily facilitate on that. We work on the disaster management as well. Just a brief highlight of our top 5 projects which we are working. There is a list of at least 20 which we can talk. I don't think we have time today. Mobile health unit, I think this is what Dr. Yasmin was mentioning before. This is the concept which me and Dr. Taimur Mirza came up 4 years ago in 2016. We now have 5 units which are running in Pakistan at the moment. The basic concept of a mobile health unit is we have a doctor who actually has all the equipment and medicines. We provide him the transport, pick him from his place, take him to a village. He runs a clinic, and there are 2 clinics in one day. So after the day, he comes back to the base, and we have a fixed rota. It's a cluster of 12 villages. And we have a cluster in Tobatek Singh, we have a cluster in Jhelum, and we have a cluster in Gojar Khan. Dr. Ansar Hayat is here. He's working for a cluster in Gujarat, a cluster in Sialkot. Shakeel Puri Bhai is working on that. So we have actually revolutionized in terms of how to deliver basic health unit at a place where nobody goes. The problem we identified was that obviously if we can give a good working environment to a doctor and obviously provide him with an incentive, he will go and work. And we have actually proven it. We are seeing about 17, 18,000 patients on their doorstep. Most of the patients which we see, we have the data. We can share the whole project. I don't want to go into much detail. Most of the people who come to our clinics are ladies. Most of them are children. Telemedicine project, we've already talked, training, free clinic, operations. Obviously, we have already discussed all this briefly, but obviously there's so much detail. I just want to quickly highlight them. We are very interested in terms of developing the systems and the pathways, because a lot of our doctors in this country are medical directors. They are clinical directors. They are actually develop the system, assess it, improve it. And this is an ongoing process, and this is the resource which we need to tap on. It's just a few pictures of our mobile health units which are actually operating, and these are all free of charge for people. We only have a purchase fee of 20 or 30 rupees, just as a token fee, so people have some value attached, and we give free medication to these people as well. Okay, now I'm going to move on to the actual topic of today. Just last two slides. One is what has APPS UK done in terms of COVID within last few months. Okay, the first step which we took was actually educating the people, and we realized that within UK there was a need of having a helpline in Urdu. And obviously we established that, and obviously people have been contacting us in terms of asking all the questions. We went on public health awareness campaigns in UK as well as in Pakistan. BBC Urdu service obviously have written articles. They took interviews of our members. We went on BBC Urdu service as well in terms of the television. And obviously this is again giving all the information about COVID and trying to educate as much as possible. We started fundraising, and we have actually sent PPE kits. We sourced them through China, and then we gave them all to National Disaster Management Authority in Pakistan, because they were our partners through Pakistan High Commission here. We realized that there are a lot of doctors who are in UK who have come here for exams like PLAB and so on. So obviously we started a campaign. We connected with these doctors. We provided them all what they needed in terms of paying for their accommodation, their food, whatever needed, transport, we provided that. And not only doctors, there are a lot of Pakistanis. As you know, they were stranded in UK as well. And some of them didn't have medication. They were in UK, their medication, because they couldn't go back. The medicines they brought with have finished. They were not registered with NHS. So we stepped in. We offered to Pakistan High Commission that we are happy to actually write prescriptions to these patients and give them medication if they need it. Our foundation wing, Dr. Iqbal, I mentioned, he has done a marvelous work in terms of food distribution. And this distribution is not only in UK, but also in many cities of Pakistan and Azad Kashmir as well. We started live webinars, started training doctors through our anesthetist here in terms of how to use ventilators, how to do gynecological, COVID patients, how to manage children, and so on. A lot of information has gone out. Then we also, not only in Pakistan, we also, lobbied with other organizations in UK, as well as I was interviewed by BBC News here in terms of the deaths of Pakistani and Asian doctors within the UK. So you've worked a lot on that. What we really need to do from now on is to see where we will want to go next in terms of prevention. Okay, so this is just like one of the old slide of previous pandemic, which is quite famous, Spanish flu. This pandemic lasted 3 years, and there were 3 waves. And so as you can see, we are at phase 1 at the moment. Obviously, the resources at that time were very different. But all of us need to come together and make sure this second wave, which was more deadly, actually doesn't come. 500 million were infected with Spanish flu at the time. 50 million people worldwide died. And our aim today is just to come together and see how we can prevent it. Thank you.
Thank you, Dr. Very nicely and eloquently explained. Seeing all this makes us feel that how blessed we are with Allah has given us all these resources and knowledge and this lovely team of selfless human beings. Dr. Saba, you can see on your screen, and I can assure you we have representation from all over the Pakistan. our membership, our leadership. They are from all the provinces and all the specialties working at various levels in the NHS in UK. And they are always dying to provide services and improve health systems in Pakistan, whether that is in person or with this new initiative of telehealth, telemedicine. I just want to make it a little comment to the viewers who are watching us around the world before we come to the next presentation. I went to see Dr. Yasmin Rashid Saiba in her office in February, and it was start with a formal kind of discussion. I must tell you that this lady is not just a minister. She's very, very kind. I saw that personally. When I walked in, I was waiting in the waiting area, and we discussed about this one young man who was selling roasted corn, makai ke dane, outside her office. And somebody mentioned that this gentleman who's, well, he's a young boy who's done an FSC. So should he not be given some support so he can continue his education? And Dr. Saiba and her team, we discussed, and including myself, we discussed him as well. I must say that it's not just being about a good politician, a good leader. There is a lot involved here, being a wife, being a daughter, mother-in-law, grandmother, and all that. So hats off to her for services. I must also want to mention one little comment here, that me and Dr. Saiba went to the same school, Convent of Jesus and Mary, which I didn't know, and which put a smile on my face to see my fellow schoolfellow. Obviously, I'm much junior than Dr. Saiba. Can we go to the next step now, please? Dr. Hisham Khan, he's going to do a presentation. He will introduce himself and then do a quick presentation for us. Thank you. Over to you, Dr. Hisham.
Thank you, Shakeel Puri. Thank you very much. So I can, I'm going to share my screen, and I believe this is it. Can everyone see my my screen?
Yeah.
Yes, we can.
Excellent. Let's read that. Yes. So as I briefly alluded, that I am actually a non-practicing clinician. I'm actually a health economist. I did a degree in health economics, 2006, I believe, from the London School of Economics. And recently I've actually done a postgraduate certification from the H.T. Chan Institute of Public Health at Harvard University. This was all about improving the quality of healthcare. Recently I have been engaged by the government of Saudi Arabia on a massive piece of health transformation, and I'm advising the vice president and the Eastern Business Region, which is all about moving from the way health is actually currently delivered to clusters or accountable care. Having experienced something very similar and advised the NHS a number of years ago on accountable care journey in the UK, in London. So I'm going to talk about what are the challenges of COVID-19. Obviously, Dr. Yasmin is living and breathing it every day, so I'm sure she knows it better than anyone else, what's happening at the government level. But I think I'd like to start with just a dashboard. This was done by Johns Hopkins University, and it's very good. It's very powerful, as it actually gives out real-time information about COVID cases in Pakistan, and again, unfortunately, the number of deaths. This was taken yesterday, so it was quite current. But the most important bit is the graph at the bottom right, which kind of shows that in Pakistan, we're still on the underside of the curve, which indicates, as Hafiz Bhai mentioned in his presentation, that we're actually in the first phase of this infection, of this deadly disease. We're still on the underside, which means that the peak of the infection hasn't arrived yet. So all the good work that's actually gone in, and Dr. Yasmin also alluded to the fact that since the lockdown has been ended, the number of cases are obviously rising, and again that's a balance that needs to be maintained, and I'm sure the government is putting in tireless efforts to try and maintain that. I believe this is completely unprecedented. None of us have actually seen anything which is the scale of disruption that is caused by COVID-19, novel coronavirus, is completely unprecedented, unknown to all of us. And I think that's where, for me, this is where I would like to probably pause and kind of focus for a little while. I mean, as Shakeel Bhai mentioned, and we've heard from all of you about Pakistan being quite unique in the sense that we thrive on the goodwill of people. I mean, there are so many charitable institutions that are actually coming together in these times. But I think we're quite uniquely placed in Pakistan that we have the governance system which obviously supports people, and then we actually have the goodwill of people that actually kind of tries to fill in the gaps that are left for so many reasons. And I think what we need to focus on today is the short-term implications of this challenge of this disease are obviously well known. We understand there's a disruption to services. We understand there is a disruption to the livelihood of people. It's not so much what happens in the short term that would actually define us as a nation as we emerge, but it would probably be what we plan for the long term, which would probably put us, or set us aside as one of the most amazing set of people that we are in Pakistan. So I think I just spent very briefly a couple of minutes on the situation in short-term planning that is obviously being done in Pakistan. And I think I've actually kind of just split it up into 5 areas which need to come together and need to work as a sort of clockwork. So clinical planning and delivery is absolutely vital. And the bit that I would actually like to touch upon is the use of telemedicine and digital health engagement tools. I mean, as recently as January, when I was advising a trust in the UK, we were kind of setting our plans up for non-face-to-face consultations. And we felt that if we could actually shift the current way of providing healthcare, and by 2025, if 50% of our consultations could be non-face-to-face, that would be considered successful. In the last 8.5 to 9 weeks, more than 60% of our consultations have been non-face-to-face. So just to say that, where there is a will, there is definitely a way. And I think digital health and digital health engagement, telemedicine, telehealth is the way forward. And I'm quite pleased that Sohail Bhai has been involved, and a few other colleagues from APPS UK in the governor of Punjab's initiative. And that's obviously something which will serve the government very well. Financial planning is equally important because obviously when the budgets were drawn and the budgets were set, we weren't obviously expecting a disruptive illness like COVID-19. So obviously those would have to be revisited. There would actually obviously be a need to have some cash available for interventions, would probably be of an emergency nature. So obviously that's something which the government has obviously done very well. This is the bit around communication engagement. I think somebody mentioned earlier on, there is a lot of pseudo information available. And a lot of social media. The social media is actually full of COVID-19 scholars, people who are actually experts in COVID-19. I think it's really important for the government to establish a single trusted source and then act as the controller of that. And then clear, concise messages could be sent out. Operational planning, again, this is all about supply chains, ensuring that we are actually protecting the people who are serving on the front line. Unfortunately, it's not something that we can say that the NHS has done very well. But I think in Pakistan there are opportunities that we could learn from our experience here in the UK. And I think with regards to the government, it's all about the coordination function. If the government can actually obviously take ownership of this fight against COVID, show their mettle as true leaders, I think there's a lot that we can achieve, and there's a lot of positivity that can be achieved. My last slide is about the post-COVID-19 world, and this is where I'm actually currently working on in Saudi Arabia at the moment. The 2 bits that I would actually like to focus here, we've touched upon digital technology. I think somebody mentioned the eagerness and the urgency of public-private partnerships, which is also something quite unique in Pakistan. We've got SIUT in Karachi. We've got Indus Hospital again in Karachi. I'm from Karachi, so I know the landscape a little better there. Supply chains, again, I mentioned that. The 2 bits that we could actually invest into at this point in time, given the fact that there's a lot of disruption, but COVID-19 also presents a unique opportunity for Pakistan as a nation, the health system there, is around predictive modeling. We don't want to be caught out when the next pandemic arrives. We ought to actually look at our capacity, we ought to look at our staffing models, And we need to have a system which is actually geared towards the future. So maybe some training. Dr. Yasmin obviously rightly mentioned about primary care in the NHS. We're extremely proud of our record as gatekeepers. My mother is a GP. I know and I see every day how hard she works. And I think that's really important. So having the workforce and our health models which are gauged for the future. And the other one is exploring opportunities for healthcare reform. And this is a specialty. This is what I do for a living. I actually advise governments, I advise institutions on how to go about transforming healthcare. So we've obviously done in the UK, we've transformed the way outpatient clinic works. We are obviously working on transforming primary care. There is a lot of digital technology. I'm actually currently working on the same in Saudi Arabia, and I would be more than happy to extend my services to the government of Pakistan. And obviously, we have a brilliant setup, which is APPS UK. The president and the CEO obviously mentioned all the initiatives that we've taken along with the government, along with different institutions in Pakistan. And I would really like to see more done. And I think, like I said, there is a massive opportunity. If you don't act now, and if you don't use this opportunity to try and change the way we deliver healthcare, I'm not sure when the next one will come. And with that, I'll probably just give the floor back to the panelists and Dr. Yasmin. If there are any questions, I'm more than happy to take those. Thank you.
Thank you, Dr. Khan. What a blessing to have people like you who are thinking and happy to provide practical, improving services to Pakistan. Dr. Yasmin Rashid Saiba, this was a little bit of an introduction and some suggestions to you. It's such a pleasure to see a female leader in the healthcare system in Pakistan. When we see and hear from yourself and like Dr. Sania Nishtar, we would like people like you to come forward and support and promote this female leadership. As you can see, the culture in our organization, that our ex-vice chair, our ex-chair, our present chair, mashallah, Dr. Samira Sheikh is sitting here. She's our head of Wales chapter. These are ladies who others follow in their footsteps and give light and hope to the female doctors to come into the leadership roles. Can we please have your words with regards to what you heard and what we can do to help and assist you, your team, with teaching, training, and providing any medical professional services to Pakistan? Over to you, Dr. Yasmin Rashid Saiba.
Thank you very much. I think everything was very informative, and I think we can go a long way in a collaborative, various collaborative programs. जहाँ तक इस वक्त आपको पता है कोविड का मसला है, जैसे आप लोग, I think UK was quite unprepared for it also, and I think Pakistan was equally unprepared for it. However, I think one of the added advantage that we had was that we did the lockdown a little earlier on when the infection came, and we were all prepared for it, because when it started off in China, I think when we heard about the problem in December, I gave instructions to my departments that we should start training people, and we developed a proper, I just show it to you, there's a proper guideline. It's a proper document which has actually been developed, which actually is COVID-19 standard operating procedures and guidelines. We developed this way back in February. It is a training manual that we developed because without whatever information that we had, because you must understand we have a huge population in Punjab. हमारी 11 करोड़ की आवाम है, सिर्फ लाहौर के अंदर आपको पता 1.25 करोड़ के करीब लोग रहते, तो हमारे लिए तो बहुत important था कि हम time से पहले we start working on it. So we started our training programs as early as in February, and before even the first case came in, we had started working on it. And the first part of our whole program was preventive. We were trying our level best to have a very strict quarantine of people coming from outside Pakistan. On detection of the cases, we were keeping them isolated, and people who could not, we weren't permitting them home isolation in Punjab. One of the important factors which has actually managed to reduce the spread of the infection in the first couple of months, as you have seen yourself. If we compare it to the other provinces, we're a little behind where spread of infection is concerned. But then gradually, in these 2 months, what we actually did was we, whatever facilities that we were lacking, we started working on them. And till date, what we have now done is we have developed 8 new labs. There are 8 new laboratories have been developed, which is BS level 3, particularly just so that we have adequate number of tests could be done where patients are concerned. And I think now daily we are doing more than 5,000 tests in all of Punjab. And to date, we have done 1,97,000 tests, which are comparatively much more than what our neighboring countries are doing with our limited resources. You do understand that one test costs us something like 4,500 to 5,000 rupees. So there's a lot of money being spent on tests at the moment. Initially, we're spending all this money on this testing so that we could form some sort of strategy based on the tests that we were getting. Like we now know that Lahore is an epicenter, and we know that Rawalpindi is another epicenter, and we know that Gujranwala is a big problem as compared to other districts of Punjab, which comparatively has smaller numbers. So by doing all this testing, we have managed to, brought in low risk districts and then high risk districts so that we could develop a certain amount of strategy differently for both these. The other important part was in this 2 months of lockdown, what we did was we have created space for quarantine for 28,000 people. Now that was extremely important to us. Why? Because initially the spread came from people that were coming from outside Pakistan, particularly the Zaireens coming in from Iran, and then we had a lot of our passengers coming on flights, and we had to do contact tracing. So all that work has been done. So during these 2 months, what we did was we developed hospital facilities. So we have about 7,500 beds allocated separately for COVID patients, out of which, of course, we have about nearly 1,200 vents that we have which are going to be separately allocated for COVID patients, and then along with that, the high dependency units. अच्छा, अब इसमें यह है कि अब जब आपको पता है कि इस वक्त हम लोगों ने ईज डाउन कर दिया लॉकअप, तो अब हम एक्सपेक्ट कर रहे हैं कि दे विल बी अ राइज. तो जो मेजॉरिटी हम होम आइसोलेशन पॉलिसी आज से 10 दिन पहले ले आए थे, तो जो मेजॉरिटी लोग ऐसे हैं जिनके सिम्टम्स नहीं हैं, या इफ दे हैव माइल्ड सिम्टम्स, we have sent them home for home isolation so that they can stay at home and not waste the resources of the government, particularly where hospitals are concerned, because we now need hospital beds for people who will be more severely affected. And number of patients who are now having moderate illness or severe illness, the numbers are increasing every day. So we need to ensure that we should have adequate number of beds available. तो इन 2 महीनों के अंदर जो लॉकडाउन था, उसके अंदर ये हमने सारी कोशिश करके फील्ड हॉस्पिटल्स डेवलप किए, इसके अंदर हम लोगों ने टेस्टिंग कैपेसिटी अपनी इंप्रूव की. इस दौरानिया में हम लोगों ने अपने बेड्स एलोकेट कर दिए. कुछ हॉस्पिटल्स हमारे जो है वो टोटली फंक्शनल हैं सिर्फ कोविड के लिए, जैसे कि मेयो हॉस्पिटल जो है, मेजर वर्क इज बीइंग डन बाय मेयो एंड देन PKLI, एंड बट नाउ with the number of cases that we are anticipating are going to increase, तो हम जो बाकियों की intensive care units हैं, they are also being now aligned with the rest of the requirements that we have, so that we have adequate number of beds. Then of course we have, through our Healthcare Commission, ensured that people who would like to have private facilities, they should also be facilitated where the private hospitals are concerned. So we have a complete, basically a control room which has all information regarding empty beds. It has all information regarding empty ventilators, the ventilators which are available for the patients. It also has कि कौन से area से अगर patient shift हो रहा है. We have a very, very robust 112 service. Our ambulance service is doing very well, and they're really, really very good in timely bringing patients to the hospitals. But अभी देखें जो major challenges हम face करेंगे. Major challenges ये हैं कि home isolation, कुछ लोगों ने people have gone home isolation, but we have recently lost 2 patients who were isolated at home, and although we were following them up, yet they only came to the hospital when the situation went from bad to worse, and saving such patients had become very difficult. Number one. Number two, the major challenge that we are now again facing is the treatment which should be given to the people who are very sick. There's so much of controversy going on, although we are already conducting research on whether hydroxychloroquine should be given to patients or not. People with mild COVID, how do they respond to it? People with moderate symptoms, how are they responding to it? We have a advisory group which is of technical experts who have already asked us to stop giving hydroxychloroquine to patients who are severely ill. We are trying to work on plasma convalescent therapy also, convalescent plasma therapy. Then we are trying to ensure that a protocol has been formed for all the patients who are being looked after. There's a uniform protocol that we have developed, and we need to improve that, because every day you hear a new story, and you do understand that we don't do autopsies in Pakistan, so you don't have a lot of information, but we are now ensuring that we do some sort of a verbal autopsy at least, so that we have maximum amount of information when the death of a person is concerned. So all these are challenges that we'll be facing in the near future, just to find out what would be the ideal treatment, because I think even with all the sort of experience all the other countries are having, even what you are having in UK, we have still not come to a definite regimen which would help a patient really. It's hit and trial majority of the places. I mean, you keep on hearing about remdesivir coming in, and then you keep on hearing maybe it's not going to be that effective. Then you have a hydroxychloroquine being very effective, and then you have papers coming in which say hydroxychloroquine is going to cause arrhythmias and is going to cause heart problems. So all these are the main challenges which we'll be facing in the future. I think Hisham explained it very well. We have, particularly where the budget is concerned, we have ensured that we have a separate budget for COVID, because जब आपके पास 11 करोड़ आवाम हो तो आप खुद एहसास कर सकते हैं कि आपको कितना बड़ा बजट की ज़रूरत है। और फिर आपको पता है कि जहाँ तक शऊर का ताल्लुक है वो आपके सामने ही है। जिस दिन हमने खोला तो लोगों ने ये सोचा कि शायद कोविड ख़त्म हो गया, और आपको पता है जिस तरीके से लोग बाज़ारों में निकले हैं, और हमें लिए एक बहुत बड़ा मसला बन गया, और हमें काफ़ी इसकी वजह से परेशानी उठानी पड़ रही है। जहाँ तक अवेयरनेस का ताल्लुक है वो आप बिल्कुल सही फरमा रहे हैं, हमने बड़ी कोशिश की है, लेकिन मसला ये है कि अगर वो इस तरह की कहानियाँ आती रही कि जी ये शायद दिस इज अ मिथ, ये तो कोई तकलीफ नहीं है। बहुत सारे लोग कहते हैं जी कोविड है ही नहीं, ये आप लोगों ने हमें डराने के लिए किया है। यहाँ तक भी लोग कह रहे हैं कि जी टेस्ट क्योंकि महंगा है और आप इसके ऊपर पैसे बना रहे हैं, तो शायद इसलिए आप हमारे टेस्ट कर रहे हैं। You're facing all that sort of a myth. But I think, alhamdulillah, till now, we have managed to, I would still consider it to be a controlled situation. However, I can't anticipate what's going to be there in the future. Probably by 30th of June, 30th of May, we would have some idea of the figures coming up. And जैसे आपने अभी उन्होंने बताया है कि जी अभी तो ये वो पहला कर्व है छोटा वाला, तो अभी तो उस पहले कर्व के ऊपर भी हम नहीं पहुंचे। आइंदा किस कर्व पे पहुंचेंगे और आगे किस तरह सिचुएशन होगी, अभी मेरा ख्याल है इट्स वेरी डिफिकल्ट टू प्रेडिक्ट, एंड देयरफॉर वी वुड बी नीडिंग ऑल सॉर्ट्स ऑफ हेल्प। अभी हमने अपने आप को पीपीज में काफ़ी ऑर्गेनाइज कर लिया है। द प्रोटेक्टिव इक्विपमेंट इज नाउ बीइंग मैन्युफैक्चर्ड इन पाकिस्तान, which is a huge added advantage to us, because rather than trying to import it from outside, now it's being produced in Pakistan. अब कोशिश ये कर रहे हैं कि जो protective equipment पाकिस्तान में बने, we're trying to ensure that enough number of ventilators are available. But end of the day, there's a huge controversy where ventilators are concerned, because at least in Pakistan, at least particularly in Punjab, we have a very poor response where the ventilators are concerned. We've hardly got, our failure is about 96%. A very small number of patients are surviving off a vent. On the other hand, it's been seen that people receiving high concentration of oxygen through nasal cannulas is producing a little better result as compared to such a interventional procedure like invasive procedure like vent. So there are all sorts of things coming up. I think we would be learning by your knowledge, because you've dealt with a far larger number of patients in UK. तो मेरा ख्याल है जो बहुत ज़्यादा मुझे information की ज़रूरत होगी is management of patients in the intensive care. What would be the ideal way to look after patients who start having respiratory problems? What would be the ideal situation? And what do we really need to do when they get onto the vents? How would they be, like, be putting them on anticoagulants also, because that was advised also. But all of this, end of the day, I think since you had more experience with patients on vents as compared to us in Pakistan, I'm sure this is something which we would really like to have more information on. So number one is, of course, care of patients in intensive care, care of patients who have been put on vents. If we get some additional information, particularly where medicines are concerned, which you think would be helpful to these patients, that would be, of course, something. So we are trying our level. We have developed a uniform protocol, but then it keeps on changing every day, depending upon what sort of results we keep on getting. Or we are still very lucky that our death rate, if you look at it, is comparatively much lower than what you have in UK. But even that is unpredictable. You never know what the sort of figures that we are going to have now. अभी आपको पता है पिछले दिनों हमने कुछ random sampling की थी जिसके अंदर Harvard और Yale and I think there was another university who participated in it, and they did an analysis, particularly for Lahore. Lahore, we had taken a huge sample of about 10,000 people. And according to them, the infectivity rate is as high as 14% in Lahore. And based on that, there would be more than 6.5 lakh of people, or nearly about 0.6 million people affected by the COVID virus. And when you compare that to the fertility rate, that is comparatively much lower. If you extrapolate the figures, then it's comparatively much lower. And I went even all the way to check up the burials in the graveyards also in Lahore, just to play it safe. कि ये ना कि खुदा ना खास्ता लोग मर रहे हो और हमें पता ना चल रहा हो. तो हमने burial ground से भी अपनी information ली है. A very astonishing information came up. Last year, between the month of April and May, we had about 5,400 deaths. And this year, between the month of April and May, we just had 21 burials. So we are in quite a bit of a dilemma about we're still not understanding how the things are going to turn up, because we can't really depend on the little statistics that we have at the moment about how the situation is going to develop in the near future. So I think that is an area which we really need help. Sohail Chuktai साहब ने जो बात कही है regarding ये जो telemedicine है, we are very appreciative of that work, because it does help a lot of people and it has stopped people coming to the hospital and thus not exposing themselves to the virus. लेकिन उससे एक problem ज़रूर है डॉक्टर साहब कि doctors have now become reluctant seeing patients. End of the day, everything can't be done on telemedicine. And therefore, we have a feeling that more and people want to opt for the telemedicine rather than being actually physically there. I don't know what are you people facing in Pakistan, in England, but here motivating the doctors is a huge problem where we are concerned. हालांकि हम इस वक्त आपको पता है incentivize भी कर दिया है, उनको extra salaries भी दे रहे हैं, और people are working at COVID level. We give them, they work for a week and then they give them 2 weeks off, basically. But we still haven't managed to motivate them the way they should have been motivated. And that is one more place which I don't know what can we really do about it. And the last but not the least, of course, is the work that you people are doing at primary and secondary healthcare level. I mean, that is, of course, my concern. कि अगर रूरल एरिया के अंदर ये फैला तो फिर हमारे लिए कंट्रोल करना मुश्किल. Though we are very lucky that we have a very good infrastructure in rural areas, all 36 districts, 10 of them have medical institutions, tertiary care hospitals, and the rest, the 26 districts in Punjab, we have huge district headquarter hospitals, which all of them have intensive care units, all of them have ventilators, and they have, to quite except for one district, they have trained staff who can look after people. So my ask from your association would be work, particularly where intensive care is concerned, because now we are from the preventive bit, now we'll have to jump onto the curative work that we need to do more and more on people who are coming to the hospitals and see if we can give them positive results. So we would be needing help there. We would be needing help where training of intensivists and training of people. So I think that would be a good idea. We could organize a training program with the primary and secondary healthcare department where you could train the people.
Can I jump in there? Sorry to interrupt you. With regards to intensive care and the proper WHO guided use of in ventilators, Alhamdulillah, we were privileged to do 2 webinars on that. And we've taken that quite seriously because that was watched and followed for well above 27 countries of medical professionals. We are happy to definitely support on that. And this motivation of medical staff, I think there is a little bit of work need to be done on the mental health services as well. Perhaps there's a lot of apprehension in people who don't understand that what actually coronavirus is going to do to them. And also, perhaps there needs to be a little bit of a good news also to be spread, that people actually have recovered, and there is a big percentage of people who only have very mild symptoms. These were my comments. May I just ask the panelists to please come in and have a little bit of an interaction session. Sohail Chughtaibai, would you like to please come in?
I think it's very good that Madam talked about telemedicine. I really appreciate her personal lead on that in certain areas. But Madam, video conferencing people are using in Pakistan, calling it telemedicine, which is very dangerous. First of all, that's my comment. Telemedicine is a clinical consultation system, not video conferencing only. Madam, you're under your supervision, PHFMC, Punjab Health Facility Management Company, under your supervision, have done the tests on telemedicine software in Pakistan, which I provided under APPS. And they found that in Rajanpur, Burewala, Sahiwal, Dera Ghazi Khan, and 5 other villages, we were able to do it very successfully. And there was an old lady sitting there, and they said that I can't take my patient to this THQ from a BHU. Allah kare mujhe ye service mil jaye, main apne mareez yahi dikha sakun. So Madam, this also helps your idea of providing specialist care.
Dr. Sohail, ये तो आपका जो program है, I've seen all that program. I've also been totally briefed on that whole program. I'm talking about the COVID situation now. You must understand the COVID situation is definitely far different from the situation that we had before. इस वक्त हमारे लिए ये problem हुआ कि जब हमने telemedicine जो है major teaching hospitals में भी इसलिए शुरू की कि लोगों को मसला ना, लेकिन मकसद ये है कि उसमें बहुत सारे लोगों ने majority wanted to volunteer for telemedicine rather than seeing patients as. अब हमारे लिए क्या problem हुआ है? Patients are, ये तो नहीं है ना कि लोगों ने बीमार होना बंद कर दिया. हमारे आउटडोर्स जो हैं उसमें लिमिटेड नंबर, हमने जानबूझ के लाहौर के अंदर 3 अस्पतालों को मखसूस किया इसके लिए कोविड के लिए, ताकि बाकी हॉस्पिटल्स में भी आउटडोर्स को चलते रहे. बट दे वर लिमिटेड. डॉक्टर्स वर स्टिल वेरी रिलक्टेंट, ऑल्दो वी प्रोवाइडेड. मेरा ख्याल है आप लोगों के पास यूके में इतना प्रोटेक्टिव इक्विपमेंट नहीं है जितना प्रोटेक्टिव इक्विपमेंट हम यहाँ प्रेजेंट करते हैं. माय ओन डॉटर इज वर्किंग in Princess Alexandra Hospital as a gynecologist, she's working as a obs and gynae person, and she has to operate on COVID positive patients. The end of the day is only when she's operating on a COVID positive patient does she get protective equipment. Otherwise, when she's looking after patients otherwise, then she doesn't have to wear that. But यहाँ हमने तो पूरी कोशिश की उसके बावजूद motivating people, and they don't have the sort of जिस तरह के हमने अपना रोस्टर्स बनाए हुए हैं, उस तरह का रोस्टर आपका यूके में नहीं है कि you give 2 weeks off to a person who's been in a COVID ward. हम 2 हफ्ते ऑफ देते हैं उनको, सब कुछ करते हैं, लेकिन वो जिस तरह की मोटिवेशन होती है and that dedication where you feel that you need to serve the patients, वो वाली पता नहीं, I don't know, maybe it's not that I've been teaching in a medical college till about 2 years ago, and I thought that as team leaders or as we were trying to motivate people, but somehow that spark is missing. I don't know how you have that in UK. और मुझे लगता है वो थोड़ा सा वो जो डर और खौफ है.
Just come in on that point.
नबीश भाई आप करें इस पे थोड़ा सा शायद.
जी उसमें ना मतलब the way our clinics are operating. जी अंसरियात भाई, you go first. अंसरियात, you go first.
मैं मैडम से एक तो ये बात कहना चाह रहा हूँ, जो मोटिवेशन का टॉपिक है खास तौर पे, क्योंकि मैं एज ए जूनियर डॉक्टर, जिसको पाकिस्तान में आप यंग डॉक्टर्स एसोसिएशन बोलते हैं, चेयरमैन था यॉर्कशायर रीजनल का, ब्रिटिश मेडिकल एसोसिएशन का। तो अभी भी मैं BMA में बड़ा एक्टिव हूँ। तो जो यूके के डॉक्टर्स की ना एक थोड़ा सा चले डीमोटिवेशन तो आ ही जाती है। इट्स वन ऑफ द साइकोलॉजिकल इम्पैक्ट दैट इट हैड ऑन इवन हेल्थ प्रोफेशनल्स अनफॉर्चुनेटली, द कोविड-19। लेकिन जो पाकिस्तान के डिफरेंस के लिहाज से मैं देखूंगा वो ये है कि पाकिस्तान की जो गवर्नमेंट है, चूंकि हम बात करते हैं डॉक्टर से भी, कोलीग से भी, और गवर्नमेंट्स में भी आप जैसे लोगों से बात होती है, तो जो गैप है कम्युनिकेशन का हमारे डॉक्टर्स के दरमियान, और ख़ास तौर पे जो डॉक्टर्स की रिप्रेजेंटेटिव ऑर्गेनाइजेशंस हैं उनके दरमियान बहुत बड़ा गैप है। और कई दफ़ा हम देखते हैं कि बड़ा डिसअपॉइंटिंगली जो उनके द वे दे कम सम टाइम एंड ब्रिंग देयर इश्यूज, हमें खुद हैरानगी भी होती है कि आप लोगों को इतना प्रोटेस्ट बाहर नहीं करना चाहिए रोड पे, जो जूनियर डॉक्टर्स हैं, या पब्लिकली जाके नहीं करना चाहिए। लेकिन जो हमें फील होता है वो ये है कि गवर्नमेंट को जो कम्युनिकेशन है, जैसे यूके में इट इज़ अ स्टैट्यूटरी रिस्पॉन्सिबिलिटी ऑफ द गवर्नमेंट टू कंसल्ट BMA इन मोस्ट ऑफ द पॉलिसीज दैट अफेक्ट डॉक्टर्स। तो वो ज़रा गवर्नमेंट ने करना तो वही होता है जो वो कर सकते हैं विद इन देयर रिसोर्सेज, लेकिन वो कंसल्ट लाजमी करते हैं। अगर कोई जनरल प्रैक्टिस से रिलेटेड मैटर है तो फैमिली फिजिशियन से करेंगे, जो कंसल्टेंट कमेटी है, जूनियर डॉक्टर्स कमेटी है। तो यूके जो पाकिस्तान की या पंजाब की गवर्नमेंट है, दे नीड टू हैव अ क्लोज लिंक with the Young Doctors Association, Young Consultants Association और PMA जो है, और उनको आप शुरू में सब पॉलिसीज के लेवल पे इन्वॉल्व करें ताकि वो अपने मेंबर्स को फिर कम्युनिकेट भी कर सकें और कन्वे करें। तो आई फील कि इससे थोड़ा मोटिवेशन में या उनको ऑन बोर्ड लेने में फायदा होगा।
Thank you. Samira, do you want to make a point? Let's have a quick points from all panelists before we come back to the Minister Sahab to answer the questions.
I think I'd like to still answers jawab मैं जरूर देना चाहूंगी. I think answer, you should understand that I've been with PMA for 26 long years and I've been the president there, and मुझसे तो ज्यादा कोई नहीं समझता ना unions को. But the bad part is that this is not a situation where any of the doctors should ever try to blackmail a government when God forbid there's a pandemic. This is not a situation. और सबसे बड़ी बात है, तकलीफदेह बात ये होती है कि right when I came as the minister, I invited all the associations. PMA तो वैसे भी मेरे साथ काम कर रहा होता है, सबको मैंने बुला के ये कहा था कि आपको कोई मसला हो तो you come forward and talk to us. And I think over the last 2 years, all the problems of the medical professionals have been sorted out without they asking us to do anything at all. Even then, you know, we must understand you play politics only if it is for the benefit of the patients and if it is benefit for the community as a whole. But you cannot play politics just to have personal benefits. Let me tell you, there's a marked difference between that. So I think we need to understand. मुझसे तो ज़्यादा कोई नहीं इस चीज़ को समझता है ना. I've been thrown out by the government twice, and I was as a professor also. But मकसद ये होता है कि if you are working towards the improvement of patients, which has never been, अभी तक देखिए हम शोर बहुत मचाते हैं मरीजों के लिए. End of the day, we always exploit patients by closing down outdoors or indoors. That we should never do. There are 100 ways to protest. That is not a way to protest. However, back to the subject, I still believe that motivational that spark, you know, हम तो जब डॉक्टर बने थे तो हम तो इस पैशन से बने के as long as we are living, we'll work for patients and we look after them. But I think, I don't know whether you're facing this there in England or not. Pakistan mein to now things have become quite on the other side. You don't see that sort of a passion among people who want to really run for patients and really look after patients. Otherwise, you wouldn't be hearing all these sort of complaints जो हमारी आती हैं कि जी हमें देखा नहीं, पूछा नहीं. You think it is possible in England that a patient is waiting for you and you would be having a cup of tea and would not get up to see a patient? So these are the things that you're facing. Hopefully, inshallah, we'll be able to improve the situation.
Dr. आपकी ये जो इतनी ज़्यादा enthusiastic मैं देख रहा हूँ उस motivation के ऊपर, APS UK has got ambassadors in Pakistan, and this is one of the reasons we're having meetings like this. Inshallah, we can work with you to create some motivational sessions with doctors working at the junior level and also at the senior level. So inshallah, we will definitely look into that. Can I ask Dr. Amber Tahir, she wants to make a point here. As soon as you mentioned your daughter, Dr. Saiba, I could see a sparkle in her eye with regards to PPE. She's done some surgeries on COVID patients in the gynae field herself. Okay. So Dr. Amber Tahir, would you like to say something?
Yeah, before I start, I must say I felt left out that everybody knew Madam, you know, as a student or as, you know, studied in the same school and the same medical school, medical college. I'm from Allama Iqbal, so I've never had the privilege to work with her or being her student, but heard very, very highly about her from my colleagues, from my friends who were who worked with her and who had been her students. So really feel privileged today to be part of this webinar and talking to her. But yeah, I just felt left out that I never knew Dr. Yasmeen Rashid personally. What a point I would like to make is, you know, the spark you were talking about. I think the spark is the difference between Pakistan and UK, I feel, is what happened with COVID-19 is that we are having regular training sessions here, regular training sessions. Like if I talk about delivery suite, we are having drills that if a COVID patient comes, where to take her, and you know how to do look after stage 1 of labor, stage 2, stage 3. If she's going for a section, which theater to go in, how to don, how to doff, and we had a proper training. And I think in Pakistan, I think that element may be needed, and I'm more than happy to provide that kind of help with my RCOG facilitator and trainer's hat on. That I think if we reassure the doctors that they are safe and they and you're absolutely right, they are provided with excellent PPEs in Pakistan, much better than we got initially here when we were facing a COVID situation. Now we have improved. I have to say we have improved, but. I think what we do from my department, I would say that we do regular COVID meetings, we update, we, as Mr. Shakeel Puri mentioned, mental health, I think we need to address that people work with stress and they are under anxiety, and stress level is there among doctors, junior, senior doctors, midwives. So if we have regular interaction and proper training and reassurance from the team, that the risk of infection can be reduced a lot. At the end of the day, we are doctors, we are here to help the patient. We can't just leave them alone and run away because we are worried that we get infected. So that's how we are working here. And I think same will happen in Pakistan if we reassure the doctors there that we are providing them training, other than the PPEs, proper donning and doffing procedures, and so that they know that the infection rate is much reduced if they do it. I've heard and I felt disappointed that many doctors are not seeing pregnant ladies because they are just telling them not to come. And WHO has clearly said that at minimum of 6 face-to-face consultations are important in order to reduce perinatal mortality, which I think is not happening in Pakistan, which is sad, which is very sad. But from my side, I would say that I'll be more than happy and I'll feel privileged if I can help at any point as regards to teaching and training for obstetric things or for donning, doffing. The other important point, which is very, very recent, has come up is that surgery has increased the risk, a mortality rate 25 to 40% higher if the patient contracts COVID-19 within 30 days of surgery. So I think my point is that cesarean section in obstetrics, the clinicians need to be updated with the recent studies, and the section rate should be, the threshold should be really high and shouldn't be offered to everybody. It should be only for obstetric reasons and for maternal and fetal compromise. So that's what I would like to say.
Mera khayal hai, what's extremely important, Dr. Saiba, कि यहाँ लाहौर के अंदर हमने गंगाराम अस्पताल को COVID for all females who come for COVID, patients are being delivered in Gangaram. And I think from this, I should go back from this webinar, and we'll organize a training session of yours with the Fatma Jinnah Medical College University, so that you can train them in the next week or so, because they're looking after majority of the pregnant women. So women with COVID for normal deliveries, they've already, I think, delivered more than 58 patients. So cesarean sections and normal deliveries. I think they would benefit a lot from the sort of experience that you're talking about, from the sort of treatment, management and particularly the sort of papers that have come out mentioning how to deal with these COVID patients. I think it's extremely important. And आप इसका मैं डॉक्टर शकील पुरी के थ्रू टाइम कर लेते हैं और हम अगले हफ्ते में आप लोगों का एक ट्रेनिंग सेशन रखवा दें जहां हमारी जो gynecologists हैं and the ones who are looking after our patients in Gangaram, they should be given this training. I think this would be a good outcome of this particular webinar.
Yeah, I'd be more than happy to do that.
Apart from just a gynecological point of view, you also mentioned this ventilator training. We have experts in that area as well, so we are more than happy to bring them together to train the treatment of ICU patients as well.
That will be very kind, Dr. Abdullah. उसका ये करना हमने अब्दुल हफीज साहब के मैं प्राइमरी और सेकेंडरी हेल्थ केयर जो है ना सबसे बड़ा हमारे लिए मसला होगा कि जो हमारे डॉक्टर्स डिस्ट्रिक्ट हेडक्वार्टर लेवल पे काम कर रहे हैं आप देखो ना टर्शरी केयर में तो फिर दे गेट लॉट ऑफ ट्रेनिंग एंड इंटेंसिव केयर एंड ऑल दिस सॉर्ट ऑफ इट जो हमारे प्राइमरी सेकेंडरी हेल्थ केयर लेवल पे काम कर रहे हैं एंड वी हैव गॉट ह्यूज हॉस्पिटल्स देयर 800 बेडेड अस्पताल है हमारे पास तो मैं एक उनके इंटेंसिविस्ट की जो है वो ट्रेनिंग आप लोगों के साथ अलहदा कर देती हूँ ऑर्गेनाइज नेक्स्ट वीक जिसमें आप उनके साथ यू कुड टॉक टू देम अबाउट to our intensivist and the anesthesiologist and everybody regarding how to look after patients in the primary and secondary healthcare, intensive care. All these hospitals have roughly about 150 events there. So we'd be very happy with that. And where gynae obs is concerned, we'd be very happy if we could get training to our doctors here in Gangaram, and we could then give it to. I could organize it not only at in Lahore, but we'll organize it in Multan and we'll organize it in Rawalpindi, but we'll do it phase-wise for a simple reason because Corona is not going anywhere. It's here to stay. And therefore, we have to change our whole lifestyle in hospitals to ensure that normal patients also get attention, and patients with COVID, we should have a proper SOPs developed for them, how we're going to really look after them. And there may be, in the near future, we might have separate hospitals, looking after COVID patients and separate hospitals looking after other patients. We'll have to work on that. And that's what we're thinking for future purposes. It will not be possible for us to mix up all the patients because end of the day, it's a huge stress on the medical personnel, the nurses, the doctors. It's not only the doctors. There's stress and the scare is in everybody, It's there in the nurses and the paramedics. And I think one thing good would be that I think you should ask if people could, and people in the nursing care could also help us where nurses are concerned, particularly if we can give them some motivational training and proper training where they feel that they're also part of the whole system and they're being looked after where their training is concerned.
Doctor, our hands are always forward to shake hand and help. And I feel that we've done something productive today. कि आप जो है ये हमारी टीम की जो एक्सपर्टीज हैं उनको पाकिस्तान के अंदर एक तो मोटिवेशन के लिए, दूसरा आपने ऑप्स एंड गायनी की बात की है, वेंटिलेटर्स और क्रिटिकल केयर आईसीयू की बात की है. मैं हमें एजुकेशन के हवाले से डॉक्टर समीरा शेख कुछ कहना चाह रही थी. डॉक्टर साहब आप कुछ कहना चाह रही हैं?
जी डॉक्टर शकील, थैंक यू सो मच. एक तो सबसे पहले मैं डॉक्टर यास्मीन राशिद ने जो पॉइंट उठाया था मोटिवेशन का, उसमें जो क्विकली एक बात कहना चाहती हूँ कि डॉक्टर साहब you might have noticed of course and we see it all the times कि एक ना आपने सही कहा कि स्ट्राइक्स बहुत ज़्यादा होती हैं और ये पॉलिटिक्स में बहुत ज़्यादा आगे हैं हमारे डॉक्टर्स, लेकिन I've personally seen videos जहाँ पे डॉक्टर्स are they've got a political agenda like it was never seen before, something like they doctor like a leader of one of the doctors organization, he's talking at the top of his voice with using really strange harsh जो कि डॉक्टर वाली लैंग्वेज नहीं होती उस तरह के वर्ड्स फॉर सर्टेन other political leaders. So I think the doctors should be they should be professional. तो इस पे कोई SOPs को follow ऐसे करना चाहिए कि जो डॉक्टर इस तरह के political agendas को convey करके, hatred spread करके, strikes को promote करके करना चाह रहे, तो they're not very professional. So I think this would be a good thing कि उसके ऊपर कोई ऐसे SOPs बनाए जाएंगे, जो ऐसे करेगा उसके लिए कुछ फिर there should be some penalties. Secondly, जो doctors जिस बात पे शोर मचवाते हैं और जिस बात पे strike शुरू करवाते हैं, वो often इस तरह की होती हैं डॉक्टर साहबा कि फैसलाबाद का एक MNA गया और एक थप्पड़ मार दिया उसने डॉक्टर के मुंह पे, तो the government should immediately act as like to go rush to protect those doctors. तो उससे ये होगा कि जो डॉक्टर्स का faith है ना गवर्नमेंट में वो ज्यादा हो जाएगा, and they will avoid those leaders who are telling them to go for strikes for any reason. So this was one point.
नहीं, I know it's a very good suggestion. आपको पता है कि अभी PIC के ऊपर you must have heard वो जो हमला हुआ था वकीलों का. I personally went in myself. वो सारे उस हंगामे के अंदर मैं खुद अंदर गई. My secretary was there with me. A lot of these junior doctors were extremely rude to me also. But I ignored everything because I needed to, pacify the situation. And the doctors forgave them. I did not forgive any of those वकील्स. आपको पता है हमने उन वकीलों के खिलाफ केस किया, उनको हमने जेलों में डलवाया, उनके खिलाफ FIRs लिखवाई, उनके अंदर anti-terrorist. I was the one who pursued this right to the hilt. And I said, we will not forgive them because they must be given an exemplary punishment so that nobody ever thinks of, ever attacking a hospital again. I was the one who took a complete stand on it. But then this is what I'm trying to say. We try our level best. And we need, मैं आपको ये बता रही हूँ ना, patients should be our top priority. मेरे लिए तो सारी जिंदगी मरीज मेरी प्रायोरिटी थे. मैं हर किस्म का काम करती थी, मरीज के कभी नहीं सफर हो. People who have worked with me would know and give an example कि मरीज के मसले में जिस जमाने में प्रोटेस्ट करती थी सड़क पे जाके, तो मैं लिस्ट सुबह 5 बजे शुरू करती थी ताकि लिस्ट मुकम्मल करके मैं निकलूं ताकि मरीज को नुकसान ना हो. This is the sort of the motivation that we need to work with, because not because of anything else. लेकिन मेरा ख्याल है इस वक्त पाकिस्तान के अंदर डॉक्टर्स के हालात बहुत बेहतर हो गए हैं. अल्हम्दुलिल्लाह इस वक्त तनख्वाहें हमने बढ़ा दी उनकी. We ensured that more and more children get a opportunity to have their postgraduate trainings done. We are trying our level best कि जी इस वक्त हमारे डॉक्टर्स को प्रोटेक्शन. आपको पता है कि जो हेल्थ इंश्योरेंस का ये कार्ड्स हमने शुरू किए हैं for the general public. I am at the moment working on ensuring that all our medical professionals also get this card, so that people don't have to depend on anybody and they have their own insurance card rather than they have a choice to go to any hospital. So we're trying our level best. But what I'm saying, it's a poor country. आप सारे इसी मुल्क के गए हुए हैं लोग. आप लोग भी समझते हैं कि पहले कितना हेल्थ बजट होता था, अब हम कितना हेल्थ बजट ला रहे हैं. अब हमारी भी पूरी कोशिश है कि हालात बेहतर से बेहतर करें. और तभी हमने इस वक्त प्राइवेट सेक्टर को भी बड़ा अपने साथ इन्वॉल्व किया है. जब हम हेल्थ इंश्योरेंस की है, there are lots and lots of people who have benefited from this health insurance card, where private hospitals have improved their facilities to give services to the people with health insurance cards. So हमारी तो पूरी कोशिश हो रही है. However, it's important कि as Pakistanis we realize the responsibility. आप लोग वहाँ बैठे हुए, आप लोगों का दिल हर वक्त दुखता रहता है पाकिस्तान के लिए. आप लोग अपनी इंस्टीट्यूशंस के साथ आपकी कितनी अटैचमेंट है. आप चाहते हैं अपने अस्पतालों में हालात जब आप वहाँ के देखते हैं तो आप भी चाहते हैं कि पाकिस्तान के अंदर ऐसे हालात हो. दिस इज व्हाट वी वांट. तो मेरा ख्याल है कि
शुक्रिया एक्नॉलेज करने के लिए कि अब इंशाल्लाह कल हमारी ईद है और हम बैठे हुए पाकिस्तान का सोच रहे हैं. और ये जो एटिकेट्स की बात है, तो हम तो अपने जूनियर्स को कहते हैं कि यू आर नॉट ओनली रिप्रेजेंटिंग योरसेल्फ, you're representing your family, your parents, who are the responsible to teach you and how to deal in public. और यहाँ पे तो हम पाकिस्तान से बाहर तो अपने मुल्क के एम्बेसडर भी हैं और अपने दीन के भी एम्बेसडर हैं. मेरे में डॉक्टर इरफान रशीद भाई कुछ कहना चाह रहे हैं.
Finish with Dr. Shakeel, जो आपने मुझे opportunity दी थी, could I just quickly say that one as well? ये जो अभी तो मैं डॉक्टर साहिबा की वो बात का जवाब दे रही थी.
I think we are running short of time, please. I think there are 3 more people waiting. Yeah, we'll come back to Samira. We'll come back to you, please.
सीमा 1 मिनट दीजिए. पहले डॉक्टर इरफान रशीद कुछ कहना चाह रहे हैं.
मेरी बात उसी बात से शुरू थी कि मैडम यहाँ पे कोई रेगुलेटरी बॉडी जिस तरह हमारी GMC है, कोई इन्वेस्टिगेशन होती है किसी डॉक्टर के खिलाफ, दे लुक एट इट कि उसकी इनसाइट क्या है, वो डॉक्टर ने ऐसा किया क्यों है. तो उसके हिसाब से वो फिर लॉज और रेगुलेशन बनाते हैं। मसलन आपने जिस तरह डेडिकेशन की बात की, तो हमारी जो मेडिकल एजुकेशन है ना, जूनियर लेवल पे जो मेडिकल स्टूडेंट हैं, मेरा नहीं ख्याल कि किसी मेडिकल स्कूल में मेडिकल एथिक्स एज ए टॉपिक टीच किया जाता है उन्हें। दे डोंट नो व्हाट द मेडिकल एथिक्स आर, ठीक है ना। वो बड़े हो के इधर उधर से सुन लें, लेकिन यहाँ पे जनरल मेडिकल काउंसिल की इतनी बुक है जिसके ऊपर मेडिकल एथिक्स लिखे हैं, and they teach them medical student from year 1 to final year, these are the medical ethics, you have to follow them. So this is something a big
जी डॉक्टर नजर इकबाल प्लीज, डॉक्टर नजर इकबाल।
In the meantime, I think मैं डॉक्टर इरफान ने भी जो बात की है ना, उसकी उसी को कंटिन्यूटी में यही बात मेरी भी थी मैडम यास्मीन राशिद के, as I said कि I am a master of medical education, तो I've always been keen कि पाकिस्तान में ना जो health का जो curriculum है medical colleges का, उसमें I would love to be involved कि उसको reform कर दिया जाए, उसको uplift करने की ज़रूरत है। We should come out of the dissection of frog and we should do some ये ethics और इस तरह की चीज़ें हम डाल दें, professionalism इसकी training डाल दें, और disaster management को भी एक important part बना दें, so that when COVID like situation या इस तरह की चीजें आती हैं तो our medical students are much more ready. So I am very keen कि एक medical teaching और उसके curriculum का पूरे का जहाँ पे audit करने की चीज़ों की ज़रूरत है वो मैं I can do that, and जहाँ पे curriculum में reforms करने की ज़रूरत है, I'd like कि पाकिस्तान के medical colleges का curriculum जो है और जो pattern teaching का है वो बड़ी universities of the world के बराबर का at par हम ले आएं, और जब पाकिस्तान के डॉक्टर्स हों उनको बाहर जाके एंट्री टेस्ट भी ना देने पड़े, इतना अच्छा हम उसको कर लें। So this is like this is my dream कि हम जाके पाकिस्तान में इस तरह की curriculum changes और ये चीजें करें।
Brilliant suggestions, brilliant suggestions. Excellent. इकबाल साहब आप कुछ कहना चाह रहे थे?
जी, अस्सलाम वालेकुम। First of all, जी, thank you very much, Dr. Sahaba. It was very nice to hear all the developments जो आपने current situation के अंदर आपने की हैं, and I think Pakistan has come a long way, and I'm really proud of the way that you have evolved certain SOPs and किस तरह आपने situation को handle किया है। मेरी एक थोड़ी सी एक उसके बारे में गुजारिश ये है कि बड़े हाईली क्वालिफाइड आपकी एजुकेशनल बॉडी है, यूनिवर्सिटी ऑफ हेल्थ साइंसेज की है, डॉक्टर्स का पैनल है, दे वर्क वेरी हार्ड टू मेक सर्टेन सेट ऑफ रिकमेंडेशंस टू टैकल पर्टिकुलर सिचुएशन। आपने उसको इम्प्लीमेंट करने के लिए अनाउंस कर दिया, थोड़े दिन के बाद जुडिशरी आती है, ऐसा रिवोक कर देती है। तो क्या ऐसा नहीं हो सकता कि पाकिस्तान की यूनिक सर्कमस्टांसिस में, क्योंकि हमारे जियो पोलिटिकल सिचुएशन बड़ी डिफरेंट है, तो दोनों पार्टीज, ऑल द स्टेक होल्डर्स, फॉर दैट मैटर इवन बिजनेस पर जो बिजनेस पीपल भी हैं, वो भी आपके साथ बैठ जाएं कि ठीक है सारा डिस्कस करें, लेकिन वंस वो इशू अ स्टेटमेंट, प्लीज डोंट चेंज इट, क्योंकि होता ये है कि लोगों का एतमाद खत्म हो जाता है, वो एक चीज शुरू करते हैं, टू मेनी चेंजेस डोंट अचीव एनीथिंग। एज लॉन्ग एज वन थिंग इज एग्रीड, गिव इट अ चांस टू वर्क। उससे पहले इतनी चेंजेस एक आता है, एक प्रोसीजर आता है, उसको चेंज कर दिया जाता है। तो अगर आप उसमें कुछ कहना चाहेंगे?
जी, मेरा ख्याल है आपने बिल्कुल सही बात कही। जहाँ तक जुडिशरी का ताल्लुक है, मैं अभी रिसेंटली आई वेंट एंड मेट द चीफ जस्टिस, और बड़ा रिक्वेस्ट मैंने उनसे कही कि बहुत सारे काम जो है एडमिनिस्ट्रेटिवली जब हम कोई डिसीजन लेते हैं और आप लोग उनको रोक देते हैं एडमिनिस्ट्रेटिव डिसीजंस को, तो हमें उसका नुकसान इसलिए होता है बिकॉज एडमिनिस्ट्रेटिवली देन वी बिकम अ लिटिल वीक। वी डिस्कस ऑल दिस, लेकिन आपको पता है कि इट इज गोइंग टू टेक अ लॉन्ग टाइम फॉर पीपल टू अंडरस्टैंड बेसिकली that we need to have our own rules and regulations. We need to follow those rules and regulations. अभी इससे पहले जो डॉक्टर साहिबा ने बात कही थी, आपको पता है कि we have a healthcare commission also, where if there is any, जिस तरह आपने कहा ना GMC के पास, if somebody, since I've been also trained in England, I have a very good idea about GMC. If somebody complains about the doctors there, इसी तरह healthcare commission की ही भी है, लेकिन we have still not become that sort of robust organizations. It's going to take a certain period of time and a lot of support from the government for these organizations to become robust. And ये जब तक सजा और जजा का कानून जो है वो काम नहीं करेगा, तो आपको पता फिर वो खतरा भी नहीं होता जिस तरह के खतरे की हम बात करते हैं। देखिए ना, जब हम काम करते थे इंग्लैंड के अंदर, तो हमें ये फिक्र होती थी कि कोई ऐसी बात ना हो जिसकी वजह से हमें कोई लिटिगेशन फेस ना करनी पड़े। या आप लोगों को पता है, एवरीबडी वाज वेरी केयरफुल अबाउट इट। At times, of course, it was very disturbing that you tried your level best and yet you would face a litigation. But end of the day, those rules and regulations definitely help you. हमें भी यही पूरी कोशिश करनी चाहिए कि हम इन सिचुएशन को बेहतर से बेहतर करें। वी आर ट्राइंग आवर लेवल बेस्ट, लेकिन बहुत अरसे के बिगड़े उनको जरा ठीक करते करते वक्त लगता है. Hopefully, inshallah, we will try to improve the situation.
Let's carry on working. Asha, we are coming to near to the end now, inshallah. Keeping to the topic, COVID-19.
Shakeel bhai, can I just chip in? And this is very relevant to the topic. Dr. Yasmeen ने बड़ी अच्छी बात की थी कि obviously we're now starting to look at corona is not going anywhere. तो वो बहुत एक बड़ा pertinent point है और बड़ा ज़रूरी है कि हम health sector के अंदर इस बात को समझें. और I think जो हुकूमत पंजाब के जो अहकामात हैं वो बहुत heartening हैं. I think सारे panelists agree करते हैं इस बात से. We're all very happy to hear all the developments that you've obviously taken forward, Dr. Yasmeen. And I think जो आपका suggestion था कि हम कुछ sites को COVID-19 sites declare करेंगे, and then obviously we'll have to run your regular services. There'll have to be some sort of resumption. तो वो एक बड़ा important aspect है इस post COVID-19 world का, या बल्कि जो COVID-19 के साथ हमें सर्विस रिज्यूम करनी है. तो उस हवाले से मैं आजकल एक बहुत इंटरेस्टिंग काम कर रहा हूँ. And obviously we're actually looking at elective surgeries, for instance, and we're obviously trying to have a risk assessment tool. I would be more than happy to share that with the government. I would be more than happy to advise should there be a need of that sort, because it's very important. और यही बातें सारी जाके affect करती हैं confidence of the workforce. और इस time पे जब हमें पता है कि हमारे पास example है of the BME population in the UK, we're obviously more affected by this illness. Unfortunately, out of the 302 people, health professionals who've passed away, a vast majority are obviously ethnic minority physicians. तो उस हिसाब से ये ज़रूरी है कि हम कोई इस तरह के protocols को वाज़े तौर पर, we actually I think अज़हर भाई की बात बिल्कुल ठीक थी कि एक source of information ऐसी होनी चाहिए जिसके थ्रू एक consistent message आए, जिससे आप confidence बहाल करें उन लोगों का. And you obviously have your plans which are obviously well articulated and delivered in certain ways that can be quite confidence inspiring for your clinicians and your workforce, not just doctors, not just nurses, but everyone. Because I think at some point in time we'll have to resume normal life, because we can't always be in a lockdown. But how do we return? When we return, what the new world would look like. So I think us bare mein I would be more than happy to establish some communication through Shakeel bhai and Abdul Hafiz saab, and then we can take that forward, because that's really important. So mujhe badi khushi hai कि obviously you are now starting to think in those ways, and that's absolutely vital, because I think that's the next logical step.
Thank you very much, Hisham. You are very enthusiastic, and your sincerity, we can see that sitting miles and miles away from you. So what we learned is the confidence, the motivation and support for the doctors who are working currently in very difficult situations. Doctors have suffered, families of doctors have suffered. Dr. Sahaba, मैं आपको share करना चाहता हूँ कि हमारे ex-chair जो Dr. Ghulam Abbas हैं, alhamdulillah, he's recovering after suffering from COVID-19. He was on a ventilator himself. Dr. Abdul Hafiz is sitting very patiently. He wants to say something before we come to the conclusive remarks from the Minister Sahaba. Dr. Abdul Hafiz sir.
I think Dr. Shaheen Anjum, please. Wanted to say something first. You the chair.
बहुत शुक्रिया अब्दुल भाई. डॉक्टर साहब ने एक पॉइंट रेज किया मोटिवेशन का, डॉक्टर्स की, प्रोफेशनल्स की. टू बी ऑनेस्ट ये इशू यहाँ पर भी था, है, अभी भी है. एक पॉइंट पे जहाँ मेरे हस्बैंड काम करते हैं, तकरीबन 80 नर्सेज वर ऑफ सिक बिकॉज ऑफ पॉसिबल कोविड सिम्टम्स, और उनको दोबारा मेन स्ट्रीम में लाने के लिए फिर इन्होंने यहाँ भी रोटास बहुत चेंज किए. आपने कहा 1 वीक काम करते हैं, 2 वीक ऑफ होते हैं. कंसर्न यहाँ वायरल लोड का आता है. तो यहाँ इन्होंने ये किया है कि पहले जैसे कंसल्टेंट्स वीकली ऑन कॉल करते थे, अब अजहर भाई मुझे करेक्ट कर सकते हैं इस पे, अब वंस अ डे करते हैं और इस तरह रोटा चेंज होता है टू अवॉइड वायरल लोड. इसी तरह जूनियर डॉक्टर्स 3 दिन करते हैं, 6 दिन ऑफ होते हैं. तो सेकेंडली जो पॉजिटिव चीज़ आपने कही है कि पीपीई पाकिस्तान में अब बन रहा है, तो अगर पीपीई अवेलेबल होगा तो मुझे यकीन है कि वो रिलेटिवली मोटिवेटेड होंगे कि उनको प्रोटेक्शन मिल रही है. तो इसके लिए थोड़ा सा ये है कि कम्युनिकेशन अगर सीनियर्स के साथ हो, अगर जूनियर्स ये फील करें कि दे विल बी प्रोटेक्टेड, अगर उनके कोई सिम्टम्स हो, कुछ हो, कॉन्फिडेंस उनको दिया जाए. स्लोली ग्रेजुअली अभी पीक शुरू हो रही है पाकिस्तान में, और हम उम्मीद करते हैं और दुआ करते हैं कि इसी लेवल पे रहे, ऊपर ना जाए, क्योंकि एक ये भी स्टडी है कि BCG जिन कंट्रीज में वैक्सीनेशन होती है वो रिलेटिवली प्रोटेक्टेड होते हैं, और यहाँ पर जो हमारे डॉक्टर्स इफेक्ट हुए हैं उसकी अभी इन्वेस्टिगेशन हो रही हैं ये BME ओरिजिन के, लेकिन कम्युनिकेशन एंड कॉन्फिडेंस अगर जूनियर्स को दिया जाए तो होपफुली थिंग्स विल इम्प्रूव। जैसे कि आपने कहा है कि कोविड तो हमारे साथ अभी रहेगा कुछ अरसे।
One of the question I'd like to ask Dr. Shakeel वो ये है, why would such a large number of people from this ethnic background, particularly Southeast Asia जो है, why would, is it because the number of doctors working on the front line were comparatively more than the Caucasians, or was it some other reason? Has somebody started working on investigating it, of the large number of doctors that you've lost there in UK?
This is something which is very close to our hearts, and APS UK, as always, have written to the government authorities to do a proper scientific research and come out with a proper written paper. So all the medical staff, their confidence come back to the normal level again. So inshallah, when that will come, we will definitely share that with you. It is hurt us basically most, because बहुत ज़्यादा ही percentage जो है BME स्टाफ जो है उनकी सफर हुआ है, तो इंशाल्लाह ताला इसको हम आपके साथ शेयर करेंगे। आज की जितनी भी हमारी जो डिस्कशन जो आपने हमारे पैनल के सामने रिक्वेस्ट की है, उसको हम प्रॉपर्ली फॉर्मली जो है उसको फॉर्मलाइज करके आपको भेजेंगे इंशाल्लाह। डॉक्टर अब्दुल हफीज, आप कुछ कहना चाह रहे हैं?
जी, जस्ट ऑन दिस लास्ट पॉइंट जो मैडम ने पूछा है रिगार्डिंग हाई प्रेवलेंस ऑफ कोविड इन हमारी एथनिक माइनॉरिटीज, इट्स नॉट जस्ट हेल्थ प्रोफेशनल्स, इट्स आल्सो in the community as well. I think there are a number of different propositions which are coming forward. One of them is 50% of patients who have actually died from COVID are diabetic. Very high, close links with overweight, high BMI, as well as low vitamin D. So these are quite significant, obviously not proven as yet, but significant observations which are being shared across the board. Even the Black ethnic minorities are 4 times at higher risk of dying from COVID. Bangladeshi and Pakistani 3.5%. Indians are a little bit low, but obviously this is not just health professionals. However, as an organization, our main concern was, as Madam has alluded to, that are more British, doctors working in the background and more Asians and overseas doctors at the front lines. So this is what we are really looking into. It's very difficult to say at this stage on that front.
Thank you very much. Dr. Chuktai, would you like to ask or comment before we close over the session, please?
I have been learning most of the times that my area is that we should bridge the gap. आजकल अगर हम बेसिक हेल्थ यूनिट से पेशेंट की ट्रांसपोर्टेशन को डीलिंक करना चाहते हैं, हम चाहते हैं कि पेशेंट अननेसेसरी ट्रैवल ना करे टू प्रिवेंट द क्राउडिंग ऑफ टर्शरी केयर हॉस्पिटल्स। टेलीमेडिसिन इज़ अ ब्रिज। जब फैसिलिटी एग्जिस्ट करती है और इसके बाद हम उसको यूज़ ना करें तो वील बी पुटिंग आवरसेल्व्स इन रिस्क, जबकि हम वो अवॉइड कर सकते हैं। मैं लंबी बात नहीं करूँगा, मैडम को सारा पता है। मैडम से मैं खुद सीखता हूँ, मैं इनको क्या बताऊँगा, लेकिन मैं सिर्फ ये गुजारिश करूंगा कि मैडम हमने जो फील्ड टेस्ट किया है, अगर आप उसको स्टडी करेंगे तो आप देखेंगे कि हाउ मच वी कैन ब्रिज, हाउ मच ट्रैफिक वी कैन रिड्यूस फ्रॉम BHU टू RHC और THQ।
ठीक, थैंक यू वेरी मच। डॉक्टर साहिबा, डॉक्टर यास्मीन राशिद साहबा, आपका प्लीज लास्ट रिमार्क्स हैं, उसके बाद मैं आपका शुक्रिया अदा करूंगा। क्या आप समझती हैं कि आज आपने हमारी टीम के बारे में, सर्विसेज के बारे में कुछ नई इन्फॉर्मेशन आपको मिली है, आपको कुछ सिंसियरिटी और इफेक्टिवनेस नजर आ रही है? थोड़ा सा कमेंट कीजिए और इंशाल्लाह फिर हम आपसे इजाजत लेंगे।
नहीं, मैं तो समझती हूँ कि जी हर पाकिस्तानी जो है उसको पाकिस्तान के बारे में फिक्र और परेशानी रहती है, और आप लोग वहाँ जहाँ बैठे हुए हैं, मैं समझती हूँ कि आपके दिल में हर वक्त जो फिक्र है कि पाकिस्तान के हालात बेहतर हों, हम तो उसके बहुत ज़्यादा अप्रिशिएटिव हैं। और हम ये अगर आज वो चांद रात को आपने टाइम निकाल के और वक्त दिया है, तो आई थिंक इट्स वेरी हाईली commendable on your part. We're extremely obliged that you are concerned about Pakistan. I think we have come out with some few important asks on our behalf. Like, for example, where trainings are concerned, I'm very happy that we could help where medical education was very close to my heart. I'd love to share it with Dr. Saiba, what we've already done here in Pakistan. We've done a huge need assessment and developed a huge curriculum how to improve the medical education in Pakistan. I did it with Gavi, which was nearly about 10 years ago. We have a whole curriculum, but I'd love to share it with her because we could bring about an improvement in it. And then Dr. Hashim's enthusiasm about what we're going to do next, which is extremely important. We need to think about what we're going to do with post-COVID time and the training for intensive care. I think this is all going to be extremely helpful to all of us, particularly where obs and gynae is concerned, which is very close to my heart because being an obstetrician myself, I need that we should be training our people properly. So I think it's been a very positive webinar, and I'm 100% sure that we're all going to benefit from it. And of course, you're going to feel good about it because you'll be helping your own country. And that is what we all should be doing towards improving the health system in Pakistan so that people could benefit from the good health system that we have.
We are very thankful.
Answer, do you want to say something?
I'm of course very impressed.
Sorry, Sohail bhai, and then we need to go to Sumaira as well for a second. Yes.
Finally, यही है कि जो आप लोगों ने मैडम जैसे देखी है PPS की leadership, we would be very happy to support, particularly on the topic of motivation और जो engagement with the junior doctors और जो consultant हैं, क्योंकि हमारे colleague भी हैं, friends भी हैं, तो part of our community हैं, we would be happy to play our part.
Thank you. जी Dr. Sumaira,
do you want to say anything?
जी नहीं डॉक्टर अब्दुल, मैंने जो वही बात दोबारा से यही है कि अगर कोई भी मेडिकल एजुकेशन के लिए पाकिस्तान में मैडम काम करने पे राजी हों, कोई इस तरह की ज़रूरत महसूस करें, whenever, and I'll love to get involved, I'll love to do everything. वहाँ पे कोई इस तरह का फोकल पर्सन हो जिसे कांटेक्ट भी किया जा सके या जब हम खुद पाकिस्तान आकर कर सकें, तो I would love to get this curriculum thing updated because curriculum हमारा बहुत ज़्यादा outdated हो गया हुआ है और I think उधर से फाउंडेशन से अच्छे डॉक्टर्स को हम बिल्ड कर सकते हैं. So yeah, that's it really. Thank you.
ठीक है, thank you very much. That brings us to the conclusion. I'm very thankful to all the panelists and the people who are watching us all across the world, especially in Pakistan. Apologies, we could not cover every single topic and ask every single question. Again, inshallah, there will be many more opportunities. I would like to conclude with a dua for all the people who we've lost in the last year, between now and the last Ramadan, and especially the victims and the injured from yesterday. I will also request everybody to do a special dua for Dr. Ijaz Ahsan Saab, a senior medical professional who passed away in the last few hours. May Allah give him the highest rank in Jannah. With all that, I would like to say thank you to all of you, and in advance, have a Eid Mubarak, and may Allah gives us many better Eids to celebrate in many better circumstances. All the best, and Assalamu Alaikum. Thank you, Dr. Saiba.
Thank you very much.
Thank you very much.